thanks for Shifa project for organizing this event. This horse was built after the invasion of Jenin in 2002. During the invasion, Israel damaged several ambulances. And with the lead of a German artist, the teenagers of Jenin used the ruins, the debris of the ambulances and a few more cars and built that horse, stationed in the Jenin roundabout. A couple of weeks ago, Israelis went to Jenin and damaged the horse and took it with them. Let's talk about the historical concept, the historical background in Palestine. So the big historical trauma in Palestine is the event took place in the events of 1947, 1948. The dispossession of the expulsion of 2/3 of the Palestinian population and the appropriation of the vast majority of the land of historical Palestine. And we see that over time, more and more land was appropriated by Israelis, and more Palestinians were made into refugees, immigrants, or citizenless people. When we talk about mental health in Palestine or health in general in Palestine, we need to understand which fragment of the land are we talking about? Which Palestinian community are we talking about? Within Palestine, we have 4 different distinct communities. Palestinians in Gaza have been besieged and isolated for 17 years so far. It explains what was going on in Gaza before this carnage. So that's everyday life for a Palestinian going through Bab al-Amud, Damascus Gate in Jerusalem. You cannot cross that area without being checked. And usually the checking is very humiliating, demasculinizing. Men are more targeted than women in this process. Very familiar now with these images that come from Gaza 2014, but every time they attack Gaza, it looks like this. This huge damage is not a natural disaster, it's man-made. And it is made massive and horrifying like this deliberately, because it attempts to break the belief system of people. It's the punishment on the civilian population. This is how people go to work or to school through checkpoints.
Occupation and demand, May 2007. Ahmed, a 46-year-old man from Ramallah, was doing well until his last detention. But this time, he just could not tolerate the long incarceration in a tiny cell, with complete visual and auditory deprivation. First, he lost his orientation to time, then he became over-attentive to the movement of his gut and started thinking that he was artificial inside his body. Later, he developed paranoid thinking, started hearing voices and seeing people in his isolated cell. Today, Ahmed is out of his detention, but still imprisoned by the idea that everyone is spying on him.
When we listen to the details of the experience of torture, we know that it is manualized, that it is done in a special way, depending a lot on what Israelis call moderate physical pressure. Many methods to psychologically to lead to the psychological breakdown of these people. When they come out of prison, you know, in interrogation, they were told that your comrades gave your name, family members, your cousins informed about you. When they come out, they have no trust in the society. Humiliation is very common, and we see the serious psychological effects on people. Go with these stories to the court and say, okay, these people have PTSD. In the case of humiliation, they don't consider that the experience meets the definition of the psychiatric definition of trauma. Study by Save the Children suggested that 80% of Gaza children suffer from depression after 15 years of blockade. Now, the problem with these studies is that usually they have already survey. They use commonly here, they use the WHO5 survey. It's the well-being survey. And of course, people score poorly on these surveys, but this doesn't mean they have depression. This means that they don't feel well regarding the life circumstances. I think the polls don't differentiate between misery, between social suffering, and psychopathology. And there is a tendency to pathologize the experiences of Palestinians. In the Western mind, Palestinians are either terrorists or people with mental health disorders. Psychiatric patients who develop acute psychosis or suicidal ideation in Jerusalem, they are referred to Kfar Shaul Hospital. This Kfar Shaul Hospital is built in Deir Yassin. For those of you who are familiar with the Palestinian history, Deir Yassin is the site place of one of the most famous massacres that established the Nakba events, the evacuation of Palestinians in 47, 48. So much has been published about trauma in Palestine. Our researchers, unfortunately, they took the definition of PTSD and used questionnaires. Some of them, for example, the Gaza Community Mental Health Program published papers saying that only 2.5% of Palestinians have no symptoms of PTSD. I work as the head of mental health services in the West Bank, and I collaborate with colleagues who are responsible for the Ministry of Health in Gaza. There is partition, unfortunately. In Palestine, we have very few professionals. I don't compare to the West. I compare it to other low middle income countries, including countries in the region like Jordan, Lebanon. We see that the number of psychiatrists per 100,000 population is very small in the West Bank